As an academic medical center that treats the most acutely sick and injured adults and children in the state of New Jersey, nurses play a critical role at RWJUH. Since May of 2022, we have added more than 200 new positions to address both the volume and acuity of our patient care needs, which are at the highest levels in decades. The increase in nursing positions is based on significant work, feedback, and data from the past 2 years, which included analytical modeling to ensure we have enough nurses to fully staff patient care during planned vacations and to cover call-outs. Ongoing work to increase nurses available to float to critical care and medical surgical units, which have been greatly assisted by offering shift differentials, also known as bonus pay. Implementing staffing adjustments based on data from audits from all the units that assessed appropriate levels. We will continue this work until we achieve the goals we have set. Hospitals nationwide continue to grapple with a shortage of nurses and all healthcare professionals since the COVID-19 pandemic. RWJUH has worked hard to hire and retain nurses during this time. The number of open RN positions at RWJUH nearly half of the average vacancy rate in the U.S. today. We are committed to further reducing it. In order to support the complex care provided by RWJUH physicians and faculty, we determine nurse staffing levels based on patient acuity. Factors here include the complexity of our patients' pre-existing conditions, the planned operations and therapies, and how long these patients need to stay in the hospital. We use evidence-based information from other academic medical centers with similar patient populations to develop nurse staffing models. This takes into account that we are a Level 1 trauma center, comprehensive cancer center, and children's hospital, and have advanced cardiovascular and neurosurgery. Patient volume. RWJUH operates at an average daily census of around 100%. We budget and staff for this volume. We always have a large number of nurses on each shift, in addition to a group of nurses that are highly skilled and float to where they are needed. Input from clinical nursing teams. The importance of input from our clinical nurse managers and our charge nurses cannot be overstated. They and they alone know the skills of their nurses and how to match those skills to the patients. For example, based on staff input and verified through benchmarking, we added an additional nurse around the clock to our pediatric ICU to address the respiratory acuity in their patients. RWJUH has been committed to providing its patients with the appropriate number of nurses, technicians, and essential healthcare professionals while under our care. We will never compromise our patients' safety or the effectiveness of their care by deviating from the standards of care delivery prescribed by our physicians and faculty. Nationwide evidence that supports the best patient outcomes and the input of our clinical nurses. Nurses are an essential part of the RWJUH family. Patient care is our top priority, and always safe nurse staffing levels is our promise and our goal, today and ongoing.